Welcome to Healthy Living. I'm your host, Amy Bouton, and I'm here today with some cardiologists from our cardiovascular clinic, and we're going to start our conversation today with Dr. Paul Stahls. Dr. Stahls, welcome.
Thank you. Thanks for having me.
Dr. Stahls is a cardiac electrophysiologist, and he has been with St. Tammany for quite some time. Can you tell people a little bit about your background for people who don't know you?
Sure. Grew up in New Orleans, Jesuit high school, went off to A&M, Ross University for med school, and then Oxford for training. And out of my second fellowship, electrophysiology, came here in 2013 and began to work with the group with the hospital, and have been building the electrophysiology program since that time.
Okay, so tell us a little bit about electrophysiology. What is that for people who don't know?
Yes, the heart is a very complex organ, and when you think about it, it's a muscular pump. But that muscular pump has to coordinate its actions like any athlete does, let's say a throw, a pitch, a bat. And that with that coordinated muscular motion, you get the optimized blood flow or hemodynamics. Mm-hmm. And so the electrical side of the heart drives the hemodynamics. Now, we can get into conversations with our plumbers, as we call them, our interventional cardiologists, and they say, well, the blood flow has to be there, and it certainly does. But the electrical, the electrical side is really where the coordination of the muscular movement comes into play.
Okay, and so that's important because your muscle has to be working optimally for all the blood to flow. So basically.
That's it. It's
all
life.
right. Well, good. Well, tell us about some of the things that are going on as far as treatment options for electrophysiology for cardiac patients and things like that. What are you seeing right now?
We're in a era of medicine, if you want to look at it just a bit more broadly, and then I'll bring us back into today. You're looking at a field that I practice in medicine that didn't exist when you and I were born. So within the 1980s and 90s is really when electrophysiology started to catch stride. The mechanisms were being teased out, the understanding of the electrical side of the heart was really being honed. And then the question of not just understanding what it is to be normal, but then abnormal, and then what in the heck do you do about it?
Right.
So we're in a transition period now from what I would say where the 90s was really the eye-opening decade. The early 2000s was wrestling with medicines versus interventions, but the interventions have continued to evolve and to hone. And so the medicines haven't really changed that much, but we're learning different roles and different ways to approach these things. So ablation is one of the top electrophysiology procedures to do to adjust the wiring within the heart, adjust how it either flows normally or abnormally.
And what is ablation? What exactly is that?
So I can go inside of the heart through the veins, and I typically get access in the groin through the veins, come into the right side of the heart, and pass very thin catheters, about the thickness of a piece of spaghetti with little electrodes on them. And then I can study how the electricity flows through the heart, determine what are bad wires, if there are any, or what area is diseased. And when I refer to disease, it is more about at a cellular level than, oh, look, I have a broken bone, can you fix my bone? It's a lot more at the biochemical and cellular level. But understanding where in the heart these things originate from, I can then go in and either modify with heat energy or freezing energy. And the idea is to purposefully scar, because scarred or dead cardiac myocytes can't conduct electricity. So it's sorting how to block the flow of either the normal or abnormal electrical signals within the heart.
So all of this, at the end of the day, it's to increase the patient's health, obviously, and their quality of life. And you have been talking about the Watchman procedure as a newer and more current thing that you guys are doing. So tell us a little bit about that exactly.
Yeah, so the Watchman device came out about 7 or 8 years ago, and we've been trying to get it here at St. Tammany for that period of time. And we've finally begun. And it's a new addition to what we call our structural heart program, and I'll elaborate on that in a minute. But the Watchman device is a small little smushy basket, if you want to think about it that way, about the size of a quarter, about the size of a stack of about 4 or 5 quarters, and it can compress down and go into a little small area of the left atrium called the appendage. It's a small little out pouch where we estimate about 90 to 95% of the clots that form inside the heart develop within that pouch. So then what we can do, instead of use blood thinners to keep the blood from pooling in that area and forming clots,
Right.
Because they're rife with their own list of issues, then the Watchman device can be inserted from inside the heart into that appendage and occlude that area of the heart so that blood doesn't flow there any longer. Procedure takes about 30-45 minutes. You're home same day. And it's really going to, I think, change the complexion of our ability to prevent clot formation within the heart. You may ask yourself, why don't I want a clot in my heart? Well, because with every single heartbeat, 20% of it goes to your brain or so. So the risk of stroke is very high. But that clot can travel off to your toe, to your gut, to your kidney, to your eyes, anywhere. And
Right.
lack of blood flow is not good. The body likes oxygen and needs it, and without that, tissue damage can occur. So.
And so candidates for this are people that I've read a little bit about it that are on blood thinners right now. So does it prevent them from taking them in the future, or can it prevent them from being on a medication for the rest of their lives?
That's the goal. And that's actually one of the biggest things with electrophysiology in general that I was attracted to, is my ability to do a mechanical fix and remove the need for medicinal therapies. Now, that's not always the case, but in this case it is. And so with the Watchman, on the day of implant, instead of being on Coumadin or one of the other very strong blood thinners that we call NOAC or DOACs, that's Eliquis, Xarelto, Pradaxa, those kind of drugs. Once we implant that, you can come off those medicines. 2 antiplatelet drugs, aspirin and Plavix, are the predominantly used alternatives. And then really for about 6 months, you monitor with echoes and make sure that that area is getting closed off with scar tissue.
Right.
And then the patient can go down to just an aspirin a day at the end of that, or nothing, depending on the other indications. So the point is within really a day, we can take your stroke risk and your need of prophylaxis using a strong blood thinner and stop that.
And potentially for
Life.
Well, that's amazing.
Yes.
That is amazing. So let me ask you this. Let's talk about the clinic itself. We just had some changes in 2023. Talk about that.
Yeah, so we added 3 new partners. One, a senior gentleman in the community, Dr. George Isa. He's a structural heart guy, interventionalist, and a great addition to our group. Then 2 new young gentlemen just came out of fellowship, Dr. Stefan Sachinsky and Dr. Hafiz Ghafour. Dr. Ghafour is an interventionalist who trained at Tulane, and Dr. Sachinsky is one of our non-invasive consulting partners, who's really an imaging specialist who's joined us as well. So we're very excited to have grown, almost doubled in size in a year. And then the second part was, we as we looked around and saw these new people at the table, we said, now what do we do with all of us? And
Where are we going to put everyone?
That's right. So we realized our clinic was not going to be able to handle everybody every day doing all the work we needed to out of it. And working with St. Tammany, identified a couple rooms in Mandeville at the St. Anne Clinic over there. And so we've opened a clinic there now once a day. Or let me say, one of our attending cardiologists goes there every day for the week. And so it's been a great response.
So now 2 locations. That's great.
That's right.
Is there anything else that you want to add about heart health, about your philosophy, anything at all before we wrap up?
Yeah, so I think the key to health is the basics. And you hear it, but it becomes lost in the noise sometimes. But really, diet and exercise. And so maintaining a good diet and treating food like a medicine will serve you well. And if you see it on TV, you probably shouldn't eat it.
If you see it on TV. I've never heard that one. That's a good one to remember.
And you know, when you go to the grocery store, I tell a lot of patients, shop on the edges. So your fruit, vegetables, meat and poultry, and then you're out of there. Processed foods in America are really probably our bane. Tobacco smoking, as nice as it can be, if you want to have an argument about it, it just can't be done on a regular basis, or you will pay the cost and need one of us to be your doctor. After that, the human body was designed to live in the wild. And so this whole thing of the concept of exercise isn't so that you can wear your jogging pants and be proud. It's because our machines were made to move. And if you don't move these machines and use the muscles and keep them strong, as we age, bad things can happen, and physically, in regards to injury, but also other medical conditions can develop.
That's all good advice. And a good way to put it, we were made to live in the wild, so movement is natural.
That's it.
Exactly. Well, thank you so much for joining us today and taking the time out. We will be right back with Healthy Living.